Hey, it's Chris Beyer.
Brad Johnson here.
Another Bottom Line Thursday. Thank you, Brad, for joining.
Thanks for having me.
Another topic from your March newsletter you wanted to cover today, talking about some financial incentives and getting people to change behavior. That's a topic
Yeah,
that we discuss a lot with our clients.
yeah. So two things. Well, actually, two things we'll chat about here. So there's a company called WondrHealth. They're a health
Yes.
promotion organization. It's employers can hire to run wellness programs. Can't talk this morning. They surveyed 73 of their larger employers and wanted to see, was there a difference between those that gave employees an incentive to sign up?
Yes.
They have higher success rates in terms of signing up, and then even long term, did those participants have better results in terms of losing weight?
Yes.
And any guesses to what they found?
I mean, you would think that the incentive would, if done right, would help people stay in it longer and have better results. I mean, that's what we would say. If you're going to incentivize somebody, that should give them the motivation beyond just I want to be healthier to do something. But you're asking that question, you're leading me.
Yeah, and that's why I like to put in the bottom line because I always like to grab stuff that might not fall into
Yes.
what you think. So many employers give incentives to do these things to sign
Yep.
up. What they found, those companies that gave incentives versus those that didn't, only had a 2% higher election rate in terms of
Wow.
trying the program, which was very surprising.
That
Only
is.
2%. And I think what was even more interesting, well, maybe not more interesting, this maybe if we had to guess, the overall success rate of those people in the programs that were given dollars
Okay.
to stay in the program and hit these milestones versus those employees that weren't given those incentives, there was no difference in weight loss results at the end of
Wow.
that.
Wow.
So the dollars can slightly change the number of participants in a
Yes.
program, but they don't
It
change the
doesn't give
end
better
results.
outcomes.
That person has to own it. So they
Wow.
can get it, they can lead them to water, but that person has to decide to drink, basically.
That's fairly disappointing because we have clients that are trying their best to not only get a wellness program, and that's very broad. What are we doing from a wellness standpoint to get kicked off, get people to engage, and then stay active in it? You know,
Yeah.
it's I know we've seen employers, incentivize with premium reductions if you're doing the wellness program, extra cash, extra prizes, things like that. But it is hard to measure results then because you can see somebody's active potentially in the program, but if it's not tracking results, is it really getting what you hope? That gives me some pause as we think about a wellness program and how to roll it out correctly.
What's interesting, now they didn't, from what I can tell in the survey, check out some employers do a disincentive. If you
Mm,
don't do certain things, you get
yeah.
penalized. I didn't see that in there. And I'm starting to see some wellness programs moving that range. But their medical officer disclosed the study by saying
Hmm.
financial incentives are just not enough to change behavior in the long run. Dr. Tim Church. So the doctor's
Interesting.
saying this. I know they,
We've
so
seen a couple of wellness programs, and it's again more of the long-term engagement. How do we keep you active in the program, gamifying the program so you're competing against your fellow employees for a leaderboard, and we've seen some good progress there that people, they want to beat their fellow employee. They want to be number one on the list. But again, is that them just completing the activities to get the points, or are they actually seeing health improve? That's hard to say, but
yeah.
yeah. I
And they
remember
have
we
to
used to
want it.
have, prior to AP, we had a company incentive for wellness. Here's a dollar amount you get to spend on wellness activities if you go through your biometric screening. And we all ended up with Apple Watches. I don't know if we got any healthier, but it was great to get an Apple Watch because that was
Yeah.
part of the incentive. And, we don't do that anymore because I wonder if we actually got results, if we were really healthier because we put money into purchasing a watch.
Yeah. And I think we'd all agree a lot of these programs, no matter what, I think encouraging healthy behavior,
Yeah.
it's a good benefit for
Yeah.
the employee too, obviously.
Oh, interesting
So,
study.
yeah, there you go.
Thank you for sharing as always, Brad. Appreciate it.
All right. We'll see you next
See you.
week.